I am Dr. Goel, SM Goel, MD Medicine and DM, और मैं जो है trying to make I want to tell you, the basic facts of our health and medical profession in a very simple language. You will understand, and that kind of insight everybody should have. So this one I'm talking about the antibiotic resistance. See, antibiotic resistance, there is no question. We doctors are very worried, and it is becoming more and more common, especially in India. So what happens is you have to understand that antibiotics are very good. They are life-saving in any infection. But what is happening is now people get sick and they just go to the chemist or pharmacist and just ask for, they get the antibiotic, they take it. Chemists also feels good about it because they feel like, almost like doctors. I'm not denying their knowledge, but still, proper treatment has to be given, proper diagnosis has to be made. So what happens is when everybody use antibiotics indiscriminately, there are always bugs which have become resistant, and once they are resistant, so none of the antibiotics will work. We just have to wait to get a new antibiotic in the market, and that can be very, very detrimental to our health. And we think we are taking antibiotic, it's not working, and it can really have serious consequences. So it's very important that all of us in US, one good thing is that everybody gets it by prescription only. Doctors properly diagnose your infection, and they take a swab, they do culture sensitivity, they also find out very quickly which antibiotic is sensitive, which bug is sensitive to which antibiotic, and they prescribe a specific antibiotic. So this is a situation in US, but we have to bring the same situation in India too. We have to insist that all the prescription medicine should be given by doctors only. People have a hard time. You don't have time. It's hard to get sometimes doctor appointment, or they have to wait for a long time, or they have to pay from their own pocket also. Easy solution is just go to the pharmacy shop which is close to the doctors and just ask them. And pharmacists are just happy to help, although it's not proper. They should not do it. But this is a culture in India right now, and it is becoming a huge problem for antibiotic resistance. We just can't. The drug companies are desperate. They can't just making new antibiotics every time. It's not that easy, and new antibiotic will be very costly also. So everybody has to understand that and do their share, and we definitely request governments of all the countries to make sure the antibiotics are not misused. Thank you.